Good morning, everyone. My name's Don Sebastian, I think. I've been traveling a bit. Yeah, it's still Don Sebastian. I'm the president and CEO of the New Jersey Innovation Institute, and we're tickled to have you all here today. I've learned over, 22 years here to never assume that everybody knows what NJIT is and anything about its background. Just a quick show of hands, how many of you are sort of first-timers here? Well, that's enough to tell the story, because I love telling the story. So if you look around these buildings, you look around the campus, you might think we're a product of what, maybe the 50s and 60s, even newer. Most of the structures here are probably even post-70s. But this university began in 1881. About 2 blocks down the street, if you know where the new Prudential building is, I think it's now a parking lot across the street, was the first home for what was called the Newark Technical School, and its formation is really unique not only amongst the universities of New Jersey, but perhaps in the country, because it was formed by a petition of local industrialists who at that time recognized they needed a new kind of education. Now that's an easy throwaway, local industrialists, who are they? Well, anybody heard of Thomas Edison? He was one of those local industrialists. He had actually took his first invention, the stock ticker tape. He built it in 3 factories here in Newark, and I think by the late 1878 or 79, he cashed out on that and bought the bucolic space in Menlo Park and became the Wizard of Menlo Park, and then relocated for a second time up to West Orange, where there's now a National Historic Site. I think at one point he had over 10,000 employees there. But it wasn't just Tom. I mean, Tom came here because Newark was really the Silicon Valley of the late 1800s. And one of his competitors, a gentleman named Edward Weston, a young Scot who had an electroplating business, invented a generator so he didn't have to rely on batteries for his electroplating business, invented an arc light, and ultimately lit up downtown Newark at about the time that Thomas was lighting up downtown Manhattan, and had the contract and put the first lighting on the Brooklyn Bridge. He ultimately decided it was better to switch than fight, and turned his business into developing the metering for the electric power industry and built his wealth and fortune on that. But that's just one example, because there was a whole cast of characters, and it didn't just start then. It goes back to the formation of our nation. And Alexander Hamilton decided that Paterson, New Jersey should be the hub for a new U.S. manufacturing economy. And what began as textile mills to process the cotton goods from the South became the silk and rayon capital of the world. It then bred machinery builders. The locomotive that did the Golden Spike ceremony was built at Rogers Locomotive in Paterson. Newark became a hub for garment and leather goods manufacturing. At one time, most of the shoes and hats in the United States were made here in Newark, and then, of course, that then spurred the growth of machinery manufacturing to feed those industries, and on we went from there to ultimately build the petrochemical industry, the pharmaceutical industry. Plastics and synthetic materials began here with the Hyatt family, and on and on and on, upon which then the state built its good fortunes. And so healthcare was also one of those important industries. A couple of brothers, I think 3, named Johnson, you might have heard of Johnson & Johnson, who began with their wares in New Brunswick and now are a global enterprise. And Becton and Dickinson, 2 traveling salesmen who got together to sell medical kits and then ultimately figured out they could make syringes and so on, and they become now a huge force. And that's the culture of this state, one in fact which we're trying to return, a growth of innovation, not just inventing things and in making things. So what does all that have to do with this university? It always had a mission to serve industry, to provide the kind of practical training, particularly for the local residents. And so the Newark Technical School became the Newark Technical Colleges. Every 30 years or so, we changed the name to keep people on their toes. Became Newark College of Engineering in the 1930s. I think it had moved up from downtown Newark in about 10 years after its formation, and has been here ever since. On what was once High Street, Lock Street behind us here was actually a lock on the Morris Canal. Times change, right? So good undergraduate education and night school for working stiffs was and always is an important thing. But by the 70s, we began to see the wholesale dissolution of corporate R&D and recognize that there was a need for not only higher level education, doctoral education to feed industry, but also development of science that can drive the growth of those industries as it was disappearing from industrial environments. And so in mid-1970s, the school made the strategic decision not only to expand its curricula and go from only Newark College of Engineering to adding the School of Architecture, and that's when we changed our name again, hopefully for the last time, in 1975 to become New Jersey Institute of Technology, but create doctoral programs and build a research enterprise. And so over time now, that's grown to, I think this year, somewhere around $130 million a year in externally funded research and development, and a lot of that practical activities. So much so that we discovered, about 3 or 4 years ago, that there were huge opportunities to expand and go beyond the academic research model, to figure out how we can do business with business by meeting their needs, not by selling what we were already doing in the research laboratories, but by inverting the relationship and saying, how can we help? And that was the genesis of creating my new organization, the New Jersey Innovation Institute, launched in 2014, and now doing about $60 million a year in externally funded research, focusing on the needs of industry sectors. In alpha order, biopharmaceutical manufacturing, the broad areas civil infrastructure, defense and homeland security, financial services, and our biggest, I guess Tom would say our best, healthcare delivery services. And what are we doing in this business? What we're doing in this business is trying to apply the thinking of the engineer and the scientist, particularly the engineer, systems thinking, to see if we can arrive at a solution that can provide at the same time better quality and lower cost healthcare delivery. With information technology as a key player in that, but it all comes driven by taking a systems perspective and a systems view. And I used to repeat this often, thinking maybe it was my own idea, and that's why no one listened. And then I found a wonderful white paper by the Social Security Advisory Board from 2009 that said it in exactly those words. It says that we need to transform healthcare delivery and think of it as a manufacturing system, apply the quality principles of Deming as a way of transforming it from an industry, an artisan industry with the Doc Welby model embedded in our mind, to something that really understands how to do care coordination, integrated delivery across the entire system. I thought in the car this morning a little bit of the Henry Ford era, that before his time, cars were made one at a time like horse and buggies were. And so all of the artisan craftsmen came to the vehicle, built it, and then built the next one, and that's why only the rich could afford cars. But Henry had the idea of bringing the work to the individual and staging it in a systematic way, so in the end you accomplished the same goal, but you did it in a much more efficient way. Well, that's not to suggest that the patient should be put on a meat hook and moved from physician to physician, but metaphorically, the IT infrastructure gives us that ability to take patient information and have it follow them to the specialists. And with each encounter, the person has as much background and information as he would had he been Doc Welby treating you since you were a child. That's the ambition, right? And at the same time, we pour into that mix the collective knowledge and wisdom of all the other practitioners who are out there, so that you're not solving things on an experiential basis, but what we're seeing now is a huge transformation in the practice of medicine that I would argue is as exciting and as different as that which ran through in the time when the school was formed. You know, you think back to prior to Pasteur, we were doing bloodletting. Medicine were tonics and elixirs and perhaps even snake oil. But when we began to understand the bacterial origins of disease, all of a sudden it was transformational. And now we began to apply science and develop medicinal chemistry. What's happening now in terms of understanding the genetic origins of disease and reaction to environment and the ability to treat things in personalized medicine is mind-boggling, but it will take a village to treat a patient. And that's perhaps the theme then of today. This is a wonderful opportunity then to bring all of you together, to think through how we move forward in that, to bring together the physicians, the hospitals, the ratepayers, the pharmacies, the clinical labs, the software, the innovators, because that's what it's going to take to move this whole practice forward in a collective way. And I can't think of a better leader to help us do that than our next speaker, Tom Gregorio, who I was fortunate to run into just before the EMR tidal wave hit, I'd say probably around 2009, where Tom at the time was, I think, CIO at Newark Beth Israel, and just finished our executive MBA program, and said, this is a golden opportunity, huh? We got to move. We got to take a leadership position on this. And I think others had not listened along the way, but I thought it was a pretty good story. But it wasn't just a story. It was a practical and important idea that we seized, and with his help, we've grown this to be the most significant enterprise in our organization. And I would argue that what he's done has now put the New Jersey Innovation Institute's iLab into the national conversation on how we solve such problems. With great backing, I see Bala smiling and nodding. Bala is our meaningful use guru, who is also gone from a kid in the classroom now to a nationally recognized expert, and many others here. So it's my great privilege to get off the stage and turn the mic over to our iLab Senior Executive Director, Tom Gregorio. Thank you.
Thank you very much, Don. It's always excuse me, great to hear Don's perspective of history of Newark. He has a great understanding and an incredible memory. So thank you, Don, for orienting us to all the innovation and all the great things that have. Sorry. So I'd like to really take a moment and thank all of you for taking time out of your day to join us for this Innovation Showcase. We have a tremendous program lined up for you today. I would be remiss if I did not take a few moments to thank everyone who worked to make this event possible. Please allow me to recognize Linda Schwimmer from the Quality Institute, who partnered with us every step of the way in making this event a success and is the chairman of our advisory board. Thank you very much. Our keynote speaker, Aneesh Chopra. He's the president of Navi Health. Our panelists, Darren Brodeur, Brian Carmelingo, Dr. Kathuria, who will be talking about IT barriers for providers and technologies to fix them. The leaders of our breakout sessions, who will all meet later this afternoon. Those are all people that you'll have access to. The staff and volunteers from the New Jersey Innovation Institute and the Healthcare Quality Institute at NJII. We're most of us wearing black to be able to orient you to the space and who's doing what. And of course, our sponsors, Hackensack Meridian Health, Newark Beth Israel Medical Center, Robert Wood Johnson, Barnabas Health, Accenture, Health IT Connections, Z Omega, and Optum for their generous support of funding our breakfast, lunch, and the lunch that is making our showcase that much more enjoyable. So when this event started 3 years ago, we had a goal of bringing attention to all the great work being conducted at NJII. Our Health IT Connections program had brought in a whole host of new entrepreneurs, and some of them you'll see outside, and to put a spotlight on the technology that is changing the face of healthcare as we know it. We wanted to engage in a conversation with providers, hospitals, and payers on how emerging technology was bringing down the cost of care, improving quality, and enhancing the patient experience, which we all know is the healthcare triple aim. And we wanted to highlight the resources that NJII was committing to making improvements to our healthcare system and the talented professionals at NJII who are working day and night to make these challenges a reality. As I look back, I am proud to say that we have accomplished these goals, and our showcase is getting better each and every year. A few years ago, we were at 150 registered individuals. We are at over 275 today. Innovation is a remarkable thing. It's never easy. There are always critics, and you can never give up if you want to succeed. A few weeks ago, I gave a presentation on innovation at a digital health summit in Trenton, and as I was preparing my remarks, I came upon an article about great innovators and inventors, the traits that make them so successful. What is it about them that make them so successful? And part of the article focused on somebody that Don mentioned, Thomas Edison, who we all know was one of the great inventors and innovators in our nation's history. The article spoke not only to his success, but also his struggle, of which there were many. In the story, the author included a quote from Mr. Edison where he said, "I have not failed. I just found 10,000 ways that won't work." Okay? It's that attitude, that perspective, and that willingness to never give up that I believe separates those who are successful from those who fail. Possibly right before the breakthrough that could have turned a great idea into a great product. And it is that innovative spirit that I want to talk a little bit more about. And it all starts with a short trip across campus, right across the street, to our CKB building, where we just opened our Agile Strategy Lab. So what is the Agile Strategy Lab, right? The lab will give entrepreneurs a safe environment to explore ideas, try new avenues, fail, right? Just like Edison did. But then ultimately succeed in launching new products into the healthcare marketplace. It will host action-oriented collaboration that more entrepreneurs towards measurable outcomes, replicable results, scalable products, and sustainable collaboration. It's a place where we can all get together and germinate ideas that will change the system that we work in. And it will start NJIT and Newark down a path that will put our university, the city, into a leadership position that drives innovation across the state and the nation. I want to thank Hackensack Meridian Health for being a foundation member of the lab, as well as Tom Bottaromo, our Chief Innovation Officer. Where's Tom? In making our new lab a reality. And there is one more thing I want to mention about Tom. Tom, can you stand up? Can you stand up? On Tuesday, NJBiz named Tom the 2017 Healthcare Hero Award winner for all of his efforts moving our healthcare ideation program forward and for his work in creating our new lab. Tom, congratulations. I'm not done. There is no person more deserving of this recognition, and I thank you for everything you do for NJII and your vision for where we are headed. Thank you, Tom. Now I'm done. Today we're going to be talking about interoperability. Interoperability is a big word, one that I've seen talked about over the last 20 years of my career. Its benefits and the improvements that can be made when healthcare stakeholders are all connected, right? I am proud to say that NJII is working with the New Jersey Department of Health on the New Jersey Health Information Network, a shared service platforms where health information organizations, providers, hospitals, and patients together can collaborate to improve care and lower costs. NJHIN will allow us to solve one of healthcare's greatest challenges, making sure a patient is identified correctly, regardless of where they are in our healthcare system. Think about it. How many times have you heard stories of hospitals billing the wrong person with the same name or worse, performing the wrong medical procedure on a patient due to the mix-up of identity? In fact, a RAND study showed that health providers mismatch patients and records on average 8% of the time. I think that's still too high. You know, you need to get to a 98% reliability rate to be safe. These mistakes not only impact health, but cost billions of dollars in unnecessary healthcare costs. The answer to this problem is a master person index that assigns patients a unique private number that ensures they will always be correctly identified and have medical records that travel with them and are updated in real time. This breakthrough is happening now as a result of our work and creation of the NJHIN with the Department of Health. And this is only one example of how NJHIN will impact health. It will also improve clinical decision-making, enhance the provider-patient relationship, link to public health registries, and advance health IT in many ways too numerous to mention. Finally, I cannot talk about technology and innovation without discussing the work of our Garden Practice Transformation Network, of which some of you are members right now as part of your doctor's offices or if your doctors and our participants. The Garden PTN is part of CMS's National Transitional Care Clinical Practices Initiative, whose goal is to save more than $1 billion in costs by moving providers from fee-for-service to value-based care. Garden PTN is truly a testament to the hard work and dedication of my team in the healthcare delivery system iLab. The team took a 50-page document, a proposal, just words on a page and created an entirely new program from scratch. So imagine we get a solicitation, we respond to it, and they give us $50 million, and they're like, okay, what do you do? Right? So all the things that we tested, all the things that we wanted to get accomplished, we've been able to put a program together that now has over 10,000 providers, part of the network in the United States, because we have 4,500 docs in Puerto Rico, a large amount in New Jersey, and another large amount in Maryland. So today we are able to partner with physicians in our network, monitor their progress, and provide guidance on how they can succeed in transforming their practices to a value-based care model. Most importantly, our partners at CMS are getting clean and real data that is allowing them to measure the effectiveness of our efforts. The program is a win for everybody. The physician win by lowering costs of providing care for patients and by showing the effectiveness of value-based care. The patients win by making fewer trips to the doctor's office, thereby saving money, time, and having better health outcomes. And our entire health system wins with improved population health, billions in cost savings, and countless numbers of lives. In fact, the Garden PTN is on track to save $135 million in healthcare costs by 2019 in the state of New Jersey. And that is something that I and hopefully everyone else here can be proud of. So in closing, I once again want to thank everyone for being here today. We'll have a great lineup of speakers, and it is my pleasure to introduce Linda Schwimmer from the Healthcare Quality Institute to say a few words.
Good morning, everyone. Oh, that was good. That was pretty good. No, it's wonderful to be here. I'm Linda Schwimmer, the President and CEO of the New Jersey Healthcare Quality Institute. The Quality Institute is the only nonpartisan, multi-stakeholder entity that's focused on looking at New Jersey's healthcare system and figuring out solutions to improve quality, safety, transparency, and to reduce costs. So all of that is a really tall order, considering that healthcare is about 1/6 of our economy and something that's essential to all of us every single day. We could not do it without so many of our members. We have all of the stakeholders of healthcare represented in our membership, and so many of you are here today and greatly appreciate your involvement in many of the programs that we work on. One of the most important initiatives that we've been working on for the past year is our partnership with NJII. About a year ago, we joined forces with NJII to focus on how to help clinicians across the state get ready for MACRA, the Medicare, I'm not going to even try to remember the acronym up here, but as some of you might know, it was slightly calmed down a little bit by the new administration, but still there's a push by the federal government to move clinicians away from fee-for-service into alternative payment models, or also referred to as a value-based system, more focused on outcomes than volume. And the Quality Institute is very supportive of that move and initiative, and we've been working on that in various ways over the years, as so many of you have. I see a lot of faces that I know are involved in that work. Together with NJII, we have been working to support the Garden Practice Transformation Network. We've recruited about 10,000 clinicians, both in New Jersey, Maryland, as well as Puerto Rico. We've been putting on monthly webinars on various topics where we have subject matter experts who are homegrown right here in New Jersey, and many of you I see in the audience who have been our subject matter experts. It gives an opportunity for clinicians who are trying to transform their practices to hear from their peers who are really standout leaders in that. And all of those webinars are archived actually on our website. So if you missed those webinars, you still have the opportunity to go back, and we will be having more of those monthly throughout the year. And they are accredited for CE credits for both physicians and nurses. So please look into taking advantage of that learning. We also work closely with the NJII practice transformation coaches, many of whom are around today, and they're working closely with many of the practice transformation coaches that are within the health plans and the other larger physicians systems as well as hospital systems. So it's a great collaboration and partnership, but all of these new models are very dependent on having the technology and the data and the analytics to be able to figure out what's going on. If we're looking at transforming the healthcare system and looking at approaching our patients in a holistic way, we need to be looking at the total cost of care, not just what services or what treatments they're having within our own walls or our own facilities, but what's happening outside those walls, as well as looking at information that comes from population health data. So looking at the other social determinants of health and figuring out ways to improve the lives of our patients and New Jerseyans overall. These are some of the innovations that Tom referred to the lab. These are just some of the innovations that we're looking at and that they're going to be tackling. And we have great partners from Hackensack Meridian Health System on the larger end of things to these smaller innovators who are doing exciting work that you see right outside today. So we're excited you could be here, and we're excited for today's lineup. And I just want to give you a brief overview of some of the things to come. So as soon as I stop talking, you're going to hear from our keynote, Aneesh Chopra, who's the president of NAV Health, the company focused on population health analytics. If you've never heard Aneesh speak before, which I've heard him speak twice now, and both times are quite memorable, so you're in for a treat. He was also the former head of IT for the Obama administration, and will be speaking about the future of open data and interoperability, which hopefully won't continue to be in the future forever. But we'll hear the inside scoop on that. We also will have a panel of experts that I'll be moderating. We have Darren Brador from Allscripts, who's also on our external advisory board, Brian Carmelengo of Accenture, Dr. Kathuria of Hackensack Meridian Health, and Dr. Mark Wedling of Lehigh Valley Physician Hospital Organization. And we're going to be discussing how they're approaching the barriers that, unfortunately, some of health information technology in its infancy have brought upon the medical system, but how they've approached these challenges and are making data and healthcare analytics work for them and their patients. Then we're going to be having a networking lunch, and after that there'll be time to hear who won the showcase contest, and all of our innovators are out there, so please stop by and say hello to them and learn about their innovations. And then we're going to be having two exciting breakout sessions, actually two sets of exciting breakout sessions, 4 breakout sessions, which are all accessible or available for CE credit. And I'm excited about all of them. Bill Zaruld, who is a senior fellow at the Quality Institute, his session is really geared towards healthcare innovators and those of you who are in the technology space. It's a 101 boot camp on healthcare policy and the landscapes and sort of what you need to know about what's changing. It'll provide you with a context of all of the work that you're doing. At the same time, the NJIT executives are going to be having sort of a technology boot camp for the clinicians that are here on how you can maximize the technology that's out there for your practice. There'll be a quick snack break because Tyler's really supportive of feeding you, all of you. And then right after that, we're going to have 2 sessions at the same time. Again, hard to choose from. I'm excited about both. We have Keegan Brown from Vitas, who's going to be leading a session which I'd say is mostly geared for clinicians, but also those of you who are really interested in this topic, like I am, on a website manner. So how to bridge the gap between your patient, the computer screen that too often now, or tablet that's in your hand, and you as the clinician, so that your patient can continue to feel paid attention to, even though there's so many data and entry requirements right now. And then at the same time, Scott Weber of Accenture is going to be talking about consumerism in healthcare, which is, obviously a topic we hear about all the time, particularly with the shift of cost to patients right now. So very excited about today, and thank you for being here. And I'm going to turn it over to Tom to introduce Aneesh. Thank you.